Healthcare, housing, food, mental health. If you're struggling to find help, you're not alone. I'm simply a social worker, and I break down real resources that actually exist step by step because help should be made simple. Is your health insurance too expensive? Did your premiums just increase? Don't panic. There are programs and options most Americans don't know about, even if you're an adult. Today, we're breaking down Medicaid and CHIP, ACA Marketplace plans, community health centers, plus how you can look at it in your state because each state differs in how they give this information out to the community. Millions of Americans are facing health care costs every year, but the good news is you don't have to go without health care. Programs like Medicaid, CHIP, and ACA Marketplace programs can help, and community health centers. They offer low cost care for the community, and many community members do not know this. So, what I try to do is make sure that you get the information, even if you don't have health insurance. Let's look into this today. Most people know that Medicaid is a government health insurance program for low income individuals. CHIP, which is better known as CHIP, but it's Children Health Insurance Program. It provides coverage for children, but many states expand options for adults, and that's what people do not know, and it's based on income changes. So if you look at the map, I'll show you that in a few minutes. But if you look at it, each state varies differently in how they give out that information. Eligibility differs by state. For example, California has expanded Medicaid for adults up to 138% of the federal poverty level. Texas, for instance, has stricter rules, so you may want to look at Texas. It means that fewer adults qualify for their Medicaid programs. If you live in New York covers certain adults with children with low income adults. You can check your state's rules at medicaid.gov or search your state plus Medicaid eligibility. Most of the time, people, when you get on there, I'll show it to you on a later slide as we get into the video, how each state differs. Because when you look at each state, you'll see that some you can call, some you can get online with a representative. Applying is usually online through your state health department. You'll need basic information like your household, your ID. Many states offer special enrollment periods.
Okay, then you can go to healthcare.gov. Right when you get on the website, it will be a pop-up. You can go ahead and X out of the pop-up, and then you can look and it'll show you, keep you up to date with plans, look at your topics. The first thing that I would highly recommend is that you go down and you look at the topics. Think about if you want to enroll in healthcare insurance, look at the enrollment dates, marketplace tips. I would highly recommend you looking at that right away. Look at how to apply and enroll, and then, of course, picking a plan. If you do not need dental this coming year for 2026, if you've just gotten your dental care done, I would hold off on it in case you don't need it. Sorry about that. Right when I did it, it clicked off. And so you can look at the Medicaid and CHIP plan. That's the one that I've been speaking about. Go to the Medicaid and CHIP plan. For every state, it's a little bit different. You should be able to pick it up. Of course, there will be some variations depending on your state. And I'll scroll right here, and then it will let you know here's some basics. In all states, Medicaid provides coverage for low-income families, including families and children, pregnant women, the elderly, and people with disabilities. I will not read all of this information to you. I just want you to see that there are different plans. You can get the basic information here. And then if you look at the very bottom, give me a second, look at the very bottom, it says get a list of services Medicaid offers in all states. Then you can click on here and look at what state, depending on where you are, it has benefits. I don't want to go too far and start confusing anyone, so I'm going to back out and go back up here. Let me scroll up to the top. And then you can always click on right here and it'll take you back over to the home page. So right here, you're back over at the home page and it's Medicaid right there and it's CHIP right here. So you can look at different resources depending on the state, Mac Learning, Medicaid data, managed care, everything that you need for the states is right here. Always look up the federal policy guidance. Give yourself time. Do not rush. This is a lot of information, but I wanted you to know where to find it. You go to Medicaid.gov. Here's the home page. We will go back there. I'll scroll down a little bit. And here's your learn how to apply for coverage. I will probably try to do a video for that. I don't want to say yes first because some things it won't allow me to do unless I put in information, and I don't want to put in dummy information and not be able to actually show you how to apply. But some notable news is down here at the bottom for eligibility and enrollment dates. This is the latest for 2025, December 23rd. And then it has the information here. Look at the dates. I would take time to at least find out the application, eligibility, and enrollment information. I would look at that first. And then once you see if you're eligible, then you look at the enrollment dates. You don't want to fill out all this information and you find out later, I'm not even eligible or I've missed the enrollment dates. So I'm going to click on this one because it's the most recent information. I don't want to go too quickly, but I did want to note if you want to save this in your browser, for those of you that are tech savvy, you know exactly what to do. But for those that are not sure, you can hit your bookmark up here and save this tab inside of your bookmarks right up here. Hopefully you can see it on my screen. And you can also excuse me, you can also create a folder and you can label the folder healthcare um, opportunities or healthcare plans or Medicaid.gov plans, some way where you can kind of track what's going on. It's going to be so many changes happening and it continues to happen, but you want to learn how to track it and then just be aware of it. So you look down here and you could kind of start looking at the highlights and things that are happening as of December 23rd. And there's a release, a new monthly Medicaid and eligibility operation enrollment snapshot. This is something great that you need to look for. And this tells you currently how many people are enrolled in Medicaid and in the CHIP program in all 50 states, including the District of Columbia. And that's as of September 2025. So that data has changed since then. I wanted to really just provide this information so you know where to go. So as you can see, Medicaid is right here, and then it lists all the different information that you would need. Scroll down on your right hand side. Excuse me, it keeps knocking me out. Okay, and then you can look at the carrot and then you can see if you need access to care, quality care, and in each one it kind of tells you what's available in your community. Okay, statewide transition plans, enrollment strategies, quality of care. And again, I'm just going over it. I'm just doing a snapshot of what Medicaid is, the services, how to get access to care. I don't want to go too quickly, but I don't want to just, I don't have the time in this video to go over every single thing. I just wanted to make sure you know to go to Medicaid.gov. And I highly advise you just to kind of take some time to find out what Medicaid offers for you, for your family. And then you can look at the CHIP program. Okay. The CHIP program stands for Children's Health Insurance. That's the name of the program, Children's Health Insurance Program. And it is a state ran program. You have to start looking through here just to find out all the information. And I don't want to overwhelm you, but if you just take your time, I highly recommend you just doing first Medicaid, not trying to look at everything, but finding out what you need for your family. That would be my first recommendation. What do we need as a family? What can we not be concerned about? If you have chronic illness in your family, you really have to read through the fine print, especially when you sign up for some of these programs. Look through the fine print. See if you have access to care before you sign up. Do not get on the phone with anyone yet until you have determined what your family needs are. And I say that because it will overwhelm you and you'll just give up, not knowing that it's information out there. You just need to be educated on where to find the information and then how does this information apply to me. So with that being stated, you go on, you look at Medicaid.gov, and then you can look at the CHIP program for those that would be interested in this information. And again, every state, they have different names, different cost shares. So I highly recommend once you get on Medicaid.gov, you just have a notebook. For those that, use notes in their phone, I have to write everything down, but it's just because I retain better if I not only see it, but also if I write it down, I pretty much can remember. So for you and your family, create a checklist. And if you have chronic illness, put that at the top of the checklist. Chronic illness, diabetes, high blood pressure. If you're managing caregiving for a family member, think about um, their health care concerns. And if you can't remember every single thing, go and get their medication and just start writing down, this is some of their chronic illnesses. And I have to make sure whatever plan that we decide for this family member or for myself, it may be for you, decide if that plan will cover you, how much the copay is. It's enormous, but it is manageable and you can do it. And I always tell the clients and some of the patients that I have, do SMART goals, which are specific, measurable, attainable, relatable, and time bound goals. And you want to make it manageable because if it's too much, people just give up. So first get a checklist. What are what are the plans that are applicable for my family? What are the chronic illnesses that are in my family? Do I have any chronic illnesses? Do I need to get dental care this year because I just got my teeth cleaned, a month ago? And so for 2026, I'll be fine not having that part of my health plan. If you just got your eyes checked and you don't have any kind of degenerative eye disease or any kind of malady with your eyes, you can opt out, not get, eye care in your plan. If that is something that is doable for you, that I don't need that. That is not something I need. Also, think about if there's things that your children absolutely do not need. In the growing stages, it's kind of hard, with the dental care. You try to make sure you stay on that unless you just went. And so, if you can wait until the next year after you see how this one goes, then you can add dental care on for the children. And I know it's not a one size fits all. I'm just giving you some ideas, some tips, and strategies that may work for your family. So I don't want to make this video too long. I just wanted to get on here and talk about Medicaid.com and where to find the information, and look again at the beginning stages. Go to the home page And then on the home page, you'll see all these bullet points where you can look up the information that you may need for you and your family. And I want to say thank you for listening. Thank you for watching. And I will see you in the next video. And please share and subscribe to Simply a Social Worker. Thanks. Bye.